Hello, my name is Najimo Akanji. I'm a mental health nurse practitioner student here in NKU for MSN 67. Here's my preceptor in person of Dr. Pius Atu.
Hello.
So we're here to discuss what we've covered so far in MSN 67. Uh, from the day one, I've been with my preceptor for 2 classes. This is going to be the third time. So 665, and now 67. So I was able to learn how to conduct psychiatric assessment and interview about various mental illness, ranging from major depressive disorder to substance abuse patient. I was able to utilize various diagnostic skill tools to assess people with mental illness, such as major depressive disorder, and I was able to have privilege to have a preceptor that guided me how to conduct a psychiatric examination about people with suicide and homicidal ideation. So also I was able to learn the rules and process that are involved in legalhood of people with suicide ideation in order to promote their safety. Well, along the way, I was able to engage in treatment of people with substance use. I learned various medications that can be used to provide treatment for people with substance abuse, such as alcohol dependency, stimulants abuse. I was able to have a privilege to utilize various medications, such as naloxone and other medications that can be used to prevent substance misuse. Here's my preceptor. You can buttress my point based on what I've learned so far.
Well, good afternoon. We're calling from Las Vegas. My name is Dr. Atu
From
from
Sana.
Sana Behavioral Health. I've had just the opportunity to work with Miss Najima. It has been, a very good, a clinical experience. I've had students in the past. One of the things I would say, with this student is his ability, to triage quickly. For the most part, assessment is a great, indicator of when a student is going to progress. So his assessment skill is really, really impeccable. He was, able, to handle patient and do complete, assessment trails, and also, review their records. And he's not very, shy asking questions. He follow, the rules of order of our admission policies, and I've seen him, progressed tremendously. So far at this point, he's doing well. He could now see the differences in medications as attributes to different diagnoses, and also is able to get questions answered from patient. So I'm looking forward to a very good better semester with him.
Yeah, equally. I know I've asked various questions from the day one, and I've been with my preceptor, but I have a few other things that I'm still have to work on. I'm still learning how to perform a comprehensive assessment of people with a theory, because sometimes last week we had a patient that came in with major depressive disorder. She was so emotional, she was crying unconsolably, and she was crying, and I lost control too. Instead of me to keep talking to him, then my preceptor advised me that when people comes in, you just have to show empathy, concern,
Absolutely.
and so to make sure that you don't get carried away with your interview, so that you don't miss the point that we want to obtain from the patient. So those are the things that I still need to work on. So hopefully, once I finish and start practicing, then I will be able to master those skills along the way. So equally, what I think I learned most in this facility is because it can be attributed to how to utilize, how to integrate medical history of the patients along with psychiatric treatment, because I found out that you have to obtain medical history of the patient along with psychiatric
Absolutely,
history
yeah.
in order to aid diagnosis and guide psychiatric care. Before, I did not think about obtaining information about medical history, but my preceptor told me that you have to make sure you know you have to gather information about the medical history of the patient, and you tailor it along with the psychiatric history to form diagnosis and guide to initiate appropriate psychiatric treatment that will promote the safety of the patient. So those are the really things that I found very interesting during the course of the clinical rotation. So hopefully by the time I finished and started practicing on my own, I'll be able to integrate those skills into my practice. So, do you have any question or any further advice for me?
Well, as I see a way forward. Your ability to really, get down. Not shy asking questions, and you've really, exemplify excellence in the way you've coordinated, patient care so far. So as we go along, I know, that you're going to show, remarkable track of improvement. All right. So that's all I could say right now. So towards the end of the semester, we'll be able to see how, you buttressed, everything you've learned, and to furtherance, you need to practice.
Okay.
Thank you.
Yeah, and like I asked you last time that in Las Vegas here,
Yes.
so most sometimes we deal with people with the suicide ideation. You said the court, we have to notify the court if we want to extend the legal hold.
Absolutely. With the L2K, which we call legal hold here, those are people, who are, we hold under, the involuntary admissions. Once, you've determined that they are the danger to themselves and the danger, to society at large, and they don't have the ability to care for self. If you're going to put them on legal hold or hold them, against their will, we have 72 hours to inform the court.
Oh.
So it's a paper we filed for that, to inform the court, immediately, so that social work services, now could, present those documents within the court. We'll review that form with you, so that you'll see, the requirement or what is required, in terms of getting those things done.
Okay. Okay. Well, thanks for having me. It's a pleasure to work with you. So thank you for the opportunity that you gave me for the last 6 weeks.
Thank you.
Bye bye.